Vinod, make it full slide. It's 9, sir.
Okay, let's start. Good evening, everybody. Welcome to this subject seminar on inflammation and wound healing. As you know, these as surgeons, though it is a controlled assault on the body, there will be assault, and we have to understand the process of wound healing, and also know what are the deterrents, what are the post and the the surgical factors, and then the disease factors which affect the wound healing. We have to optimize the patient's condition, and we also have to look after the patient well in the post-operative period, so that we'll be able to facilitate wound healing. So with that in mind, start.
Shall I start, sir?
Yeah.
Good evening to everyone, sir. Today's topics to be covered about introduction to inflammation and types of inflammation, and classification of wounds and phases of wound healing and types of wound healing. Inflammation. The definition of inflammation: it is the response of a living tissue to an injury due to whatever is the agent. And the cardinal signs of an inflammation is rubor, color, dullor, tumor, and functionolacia. And these we find in the clinically as rubor as redness, and color as temperature, dullor as pain, tumor as swelling, and functionolacia as loss of function. And types of inflammations: acute inflammation and chronic inflammation. And these are divided into acute and chronic basing on the day, which cannot be clearly demarcated using a days, as acute inflammation is from days to weeks, and chronic inflammation is from weeks, months, and years. And in acute inflammation, there will be only neutrophils. In chronic inflammation, there are macrophages and lymphocytes. Acute inflammation, it is divided into events for our understanding. And it is vascular phase and cellular phase. Vascular phase, it divided into vasoconstriction, vasodilation, increased vascular permeability, and stasis. In vasoconstriction, it is the transient phase which starts initially during an injury, and it helps to decrease the bleeding. And vasodilation, it is due to histamine, and it leads to the dilation of the blood vessel, and it leads to pooling of blood over the injury site. And increased vascular permeability, it is due to serotonin, which increases vascular permeability, which leads to increased pooling of blood over the injured site, and it leads to stasis of blood, and this leads to the blood in the blood vessel converts streamlined flow into turbulent flow. And cellular phase, it contains margination, rolling, adhesion, diapedesis, chemotaxis, and phagocytosis. Due to stasis, the cells which are in the centrally in the blood vessel, they migrates towards wall of the blood vessel, due to which the cells adheres to the blood vessel and leads to margination, and then the rolling, and then to adhesion. And after the adhesion, the cell try to come out by diapedesis, and then due to chemotactic factors, it moves towards the injury site, and then these cells helps in phagocytosis. During phagocytosis, the neutrophils or macrophages engulf the bacteria and forms phagolysosome. These phagolysosomes contains lysosomal enzymes which are acidic. These lysosomal enzymes kill the bacteria and leads to death of the bacteria. And for when it is not a bacteria, if it is a parasite, it leads to formation of HO iodide, which kills parasite. These are most commonly present in eosinophils, and this is the reason in parasitic infections eosinophilic rise will be present. And inflammation will be immediate and transient response, immediate and sustained response, and delayed and prolonged response. In immediate and transient response, the inflammation will be only for 10 minutes and it will go up. And example is coffee spillage. And in immediate and sustained response, the inflammation will be around for 24 hours. It is due to a boil formed by during a cooking, and which the boil will reduce by 24 hours. And delayed and prolonged response, which is seen in radiotherapy. This is the reason why the radiotherapy cycles are kept between after 15 days for every, there is a gap of 15 days for every cycle. And chronic inflammation, inflammation of a prolonged inflammation due to prolonged duration, in which active inflammation, injury, and healing will be present simultaneously. And it includes angiogenesis, mononuclear cell infiltrate, and due to which scar formation will be more. Examples are foreign body in the wound, which leads to granuloma, and it leads to prolonged inflammation, which leads to chronic wounds and tuberculosis. And mediators of inflammation, which are preformed, are histamine and serotonin, and newly synthesized are prostaglandins, leukotrienes, and platelet activating factors. And plasma protein derivatives are complement proteins and factor 12 protease activated during coagulations. And factors helps in vasodilation are prostaglandins and histamines, and which increases vascular permeability is serotonin, which is a vasoactive amine. And chemotactics is helped by interleukin 8 and C5a. And pain is due to prostaglandins, especially PGE2. And tissue damage is by macrophages and neutrophils and bacterial. And prostaglandins are formed due to phospholipids which are present in the cell membrane. These are acted by phospholipase A2, and which is converted into arachidonic acid. An action of COX enzyme, these prostaglandins are formed. And for this reason, we should not use steroids which inhibits phospholipase A2, which leads to decreased formation of prostaglandin. And COX is inhibited by NSAIDs. So NSAIDs are also used cautiously during an injury. Can I continue, sir?
Just a minute. Now, Abdul.
Yes, sir.
So take over, see what
Yes, sir.
needs to be done.
Any questions from anyone? among the PGs.
What do you understand from the difference between acute and chronic inflammation?
Sorry, sir.
What is the difference between acute and chronic? What is the main thing? Why you call it as a chronic?
Mainly due to duration and 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 other thing is excessive wound healing, which leads to delayed wound healing and excessive scar formation.
Okay. Other than that, any other factors which causes the chronic inflammation? For example, the chronic inflammation happens when there is a failure to eliminate the agent which causes the acute inflammation. Understood? No, like our body
Yes, sir.
defense will eliminate based on the phagocytosis, etc. Or else
sir.
exposure to low level of particular irritants for a longer time, like that. Okay, so
Okay.
those are the reasons that becomes a chronic inflammation, right?
Okay.
Vinod, what do you mean by NK cells?
Natural killer, sir.
What is their role?
Sir, actually, for a defensive, it is a part of defensive mechanism, sir. It is a first primary defense mechanism. When compared to macrophages and neutrophils, these three are coming from the same lineage, but it doesn't have MHC marker, sir, for natural killer cell, due to which it cannot act particularly on the particular bacteria. It only acts on the activated cell, which is activated by macrophages or neutrophils.
No, actually, they don't require activation. No, that's why it is called natural killer.
Natural killer.
And other role, one more role.
Sorry, sir.
In tumors.
Natural killer role, sir.
Yeah, NK cells, role of NK cells in tumors.
No, sir.
Also, it helps in controlling the tumor activity.
Okay.
Along with bacterial infections and other things, they also help in preventing the tumor formation.
Yes.
And they respond to whenever the tumor is formed.
Okay.
They are nothing but form of lymphocytes.
Okay.
Form of L8 cytotoxic lymphocytes.
Okay.
So we know from beginning,
yes, sir.
Stop this. Whenever don't repeat the question. Whenever see what happens is, if you develop this habit in the exams, you do the same thing. When the examiner asks you a question, you will repeat the question, and that irritates the examiner. So understand the question properly. Whenever you have to show a lot of concentration when you are being questioned, so that
Yes,
you
sir.
understand what the question is. Otherwise, politely ask him. Don't repeat the question. That looks very sort of very irritating to the examiner. Okay,
Yes,
so you have to avoid this, because you have started just now. If you continue this habit, you will it becomes a habit for you.
Okay, sir.
Janani, any questions?
Sir, no, sir. No, sir.
Is Janani's your connection is
Sir.
bad, is it? Can you hear me properly, Janani?
Yes, sir. Am I not audible, sir?
Abdul?
Yes, sir. We can
Her
hear
voice
you,
is
but I think
breaking. She
her
is still
voice
at
is
home,
breaking.
sir, so
Yeah.
network is.
I think from
Yeah.
her phone she has done.
Yeah. I think Janani, reconnect yourself, because you are not clear in your response. You can't hear you.
Okay, sir. Okay, sir.
Okay.
Yes, sir.
Yeah, now it is better. I don't know what you did just now.
Yes, sir.
Pawan, any questions?
No,
Pawan,
sir.
any questions?
No, sir. No,
Everything is clear?
sir.
See, Vinod,
Sir.
see, with the chronic, I think what Abdul Viswan Hari said, see, can tuberculosis cause acute inflammation?
Yes, sir. It can cause.
Can foreign bodies cause acute inflammation?
Yes. Initially, it forms acute inflammation.
Yeah. So then what is the difference between acute inflammation and chronic inflammation?
Persistence and the macrophage which cannot kill the bacteria or which cannot remove the foreign body, which
Yeah,
leads to
that is what you should say. This is in complete, see, in acute inflammation, whatever is the source of the inflammation, that is either bacteria or virus or chemicals or foreign body or whatever it is eliminated by the body by the acute inflammatory reaction. It will inflammation flood the area with the serum and the macrophages, and then the polymorphonuclear cells, which is neutrophils, with then epithelial cells, epithelioid cells, all of them, and with the help of the component, as you said, leukotrienes and component and everything, will eliminate the foreign body. So if the foreign body is persistent, or if the bacteria or the virus or whatever it is persistent, then over a period of time, I think both of them get used to each other. There will be, reactions, inflammatory reaction. There will be healing, as you said. There will be fibrosis, and all of these things will be going on. So I think that is the most important. And then instead of the polymorphonuclear cells, you get lymphocytes, which will then take over, which is why there will be significant lymphocyte infiltration in chronic inflammation.
yes.
So that is the essential difference. You have to understand that. Okay. Hari told you that. I don't know whether you understood it. Okay.
One
Abdul?
more point to add, sir. If you,
Yeah.
your points are correct that the time duration and etc. Only thing what
Yes.
we extra add to this is, like, for example, diabetes and cancer, like Abdul sir told, no? So are they a chronic inflammatory disease or how?
Yes, sir. They are also chronic inflammation.
Exactly. That's what I wanted. So it's not only about the wound. See, there are chronic inflammatory diseases like diabetes, cancer. Okay.
Yes, sir.
So like even arthritis, allergy, etc. So the inflammation applies there also, right?
Yes, sir.
So that's the only thing you have to understand. Not only to the wound it applies. Okay.
Yes, sir.
Right. Carry on. Kavya, is there anything you want to add?
Not much, sir. Just wanted to understand, like, make sure that Vinod understood that about chronic inflammation, and also what components of inflammation are helpful and what are harmful to the host itself.
Yeah, I think that is an important point. Vinod,
Sir.
what parts of the inflammation is helpful? What parts are harmful?
It didn't get actually.
What?
Like,
You
for
didn't?
example, we didn't understand. For example, now, if in tumor and all, is inflammation good in cancerous conditions and all that, or
Yes, madam. Inflammation is good thing when it is for accurate for a certain period. Then it will be a dangerous thing as it is damages our own body. Because of inflammation only, we recognize that something is going on in our body.
See, the classical example, I think, Kavya, do you want to come in on that, or shall I? Yeah, you tell them. What are the positive aspects of inflammation? What are the harmful aspects of inflammation?
definitely. So in body itself, without inflammation, there would be no healing to begin with. It is not just, of course, as you said, it is what signals. It starts from the signaling pathway that something is wrong in the body, and then
Yes, ma'am.
it induces. Also, obviously, there will be like a response and healing, but they're sustained like scars. When actually there is anti-inflammatory response in the body,
Yes, ma'am.
which is there only to subside the inflammation, because once the work is done, it has to go down inflammation. It can't keep on persisting, because or else it will become systemic inflammation.
Okay, ma'am.
So when you do not have adequate amount of counter inflammatory like scars, what we call actually it is, that time it becomes persistent. Then it is going to be harmful, because too much, as you said, vasodilation, hypotension, shock, all that would be harmful to the body.
We know the other thing is, for example, in patients, See, I give you two good examples. One is Hashimoto's thyroiditis. See, initially, when there is thyroiditis, it is autoimmune. Whatever. Hello? Some disturbance.
Sir, can you mute?
Hari, just mute
I muted.
everybody.
I muted.
Yeah, yeah.
I muted.
So, initially, whatever is the cause for Hashimoto's thyroiditis, there is inflammation. And then this ongoing inflammation will then cause what is called as, auto antibodies to be triggered. And these auto antibodies, systematically destroy the entire thyroid gland. So in the initial phase, there will be, because of the destruction of the acinine, there will be release of the thyroid hormone, which has been already secreted and stored, and hence you will get hyperthyroidism. And later, as the number of acinine get destroyed, the number of cells get depleted, then you become hypothyroid. So this is a classical, as Kavya said, classical example of inflammation gone wrong. And then it entire consumes the thyroid in the end and makes the patient hypothyroid. That is one. Second is the classical case of acute pancreatitis. Initially, whatever the insult, either gallstone disease, virals, alcohol, drugs, or post ERCP, post-operative, whatever is the inflammation, later the inflammation that is set off in the pancreatic cells will release the enzymes, which then get, they're supposed to be only activated in the lumen of the duodenum. So when they are activated outside of the cells, they start digesting the pancreas itself and the surrounding tissue, which causes all the destruction that is associated with pancreatitis. Like you can get, the pancreas becomes necrosed. You can get, the blood vessels get digested and you have severe hemorrhagic pancreatitis. You can get even major vessels, splenic vein thrombosis, there will be clotting of the splenic vein. You can have visceral vein thrombosis. You can have splenic artery aneurysms. So it can be a gamut of the inflammatory process which carries on, which many times kills the patient. So acute pancreatitis is another classical example of inflammatory response gone wrong or gone haywire. So I think Kavya is very right. The inflammatory response is necessary. It is protective to the body. But as and when the inflammatory response to the noxious agent, which may be bacteria, virus, foreign body, chemicals, whatever it is, as soon as the toxic agent is taken care of, the inflammatory process has to scale down. If that doesn't happen, then you can have problems. Again, with diabetes, as Hari said, diabetes, and you also in cancer, if there is excessive inflammatory response, again, that can be harmful to the body. So it is always, anything in excess is harmful. So that you have to understand. Okay?
Yes, sir.
Okay, right, carry on.
Wound healing. It is a process of repair in which is a complex and a dynamic process of replacing devitalized and missing cellular structures and tissue layers. And the history of wound healing. In 2000 BC, they have tried with spiritual methods and physical methods. And Egyptians, they divided it as infected and non-infected and treated in a different way. And Eber Papyrus tried honey, lint, and grease to treat the wound infections. And the Louis Pasteur said the theory of spontaneous generation. And then Joseph Lister first discovered the antiseptics. And then Robert Johnson developed a gauze piece with antiseptic called iodoform. And then in 1970s, the polymeric dressings are developed. Wound healing is a mechanism in which the body tries to develop its integrity of injured part, in which it will be helping. Its attempt is by regeneration or repair. In regeneration, there won't be any scare. In repair, there will be a scare. for regeneration, there is a need for pluripotent stem cells. But the healing needs depends on nature of cell and severity of injury. And nature of cell, it is of three types, which is labile cell and stable cell and a permanent cell. Labile cell is a cell which is continuously dividing. Stable cell is a cell when there is an injury, it starts dividing. Permanent cell is a cell which does not divide. And the labile cells, for examples, are GIT lining, which are epithelial cells, and keratinocytes of skin. And for a stable cell, examples are cells of liver. And the permanent cells are striated muscles, cardiac muscles, and neurons. This is the reason why in liver it can regenerate when there is an injury or if you give time. And in labile and in the GIT, as epithelial lining of the GIT is continuously replacing, the chances of getting mutations and are less, and development of cancers will be decreased. And factors affecting wound healing: age, structures involved, mechanism of wound, loss of tissue.
Just a minute.
Yes, sir.
Go back to this liver. So what is special about liver?
Sir, when there is an injury to a particular, if any other visceral organ in a body, if there is an injury, they can't regenerate, but liver can regenerate on its own, as it contains stable cell which can divide when there is an injury.
Yeah, so that is so that's a good thing. So give
Yes,
me two clinical scenarios where it is good and once where it is bad.
In cirrhosis, there is a fibrosis of liver, sir, and there will be from the normal hepatocyte, there will be development of new hepatocytes and forming to nodules.
Correct. So there is ongoing destruction either due to alcohol or due to hepatitis B and C viruses or any other injury or stasis in the, for example, primary biliary cirrhosis, and also other alpha-1 antitrypsin, hemosiderosis, hemochromatosis, Wilson's disease, all these things where there is on the either deposition of these hemosiderin or copper or whatever, there is that induces inflammation and destruction of the hepatocytes, and these hepatocytes which are destroyed are replaced by fibrous tissue. And then there is liver cells which are not affected by this, by the side of it, which keep regenerating, and that causes the nodule. So some of the for example, hemochromatosis, hemosiderosis, all these things, they will usually cause what is called as micronodular cirrhosis, because it's chronic process, it's a metabolic process, but it has been ongoing for a period of time. On the other hand, the acute injuries like liver, it's an alcohol and virus and things will cause usually what is called as macronodular cirrhosis, because there is significant destruction of liver along with significant regeneration of the liver, and these regenerated areas will form nodules. So that is the good thing or bad thing of liver, this one. But more importantly, I think I think all of you know the legend of Greek mythology. Does anyone remember that?
Prometheus, sir.
Prometheus was tied to a
Rock.
this one. What is
Boulder. He was boulder on the hill. And that eagle keeps eating part of his liver daily.
So this was actually it was a punishment. They knew, the Greeks knew that liver would regenerate, and that is why they left the liver open, and the eagle would peck on the liver every day, and he would be in constant pain because of that. So that actually been utilized now in liver transplantation. So basically, the related donor transplantation, you remove half the liver from the donor and transplant it to the recipient, and in 3 to 6 months time, both donor and recipient we'll have almost a full component of full complement of liver. So that is the advantageous, position of this liver being having stable cells. Okay,
Yes, sir.
continue.
As the age increases, the immunity and the ability of a cell to divide decreases, and which leads to difficulty in wound healing. And when the structures involved are like skin, only superficial things, then the wound healing will be very fast and good. And when there is an involvement of bones, muscles, the healing will takes time and prolonged. And mechanism of wound, when there is a wound due to crush injury or a infective crush injury, contamination, this leads to delayed wound healing. And whereas when a injury due to due to incision, the healing will be fast because it is a smaller injury and it is a clear injury. And loss of a tissue, when there is a excess of loss of tissue, it heals by fibrosis, and it takes long time. And malnutrition, when there is a deficiency of vitamins, for example of vitamin C, which is helpful in formation of collagen, it leads to delayed formation of collagen, which leads to prolonged phase of proliferative phase, which leads to delay in wound healing. And medications like steroids, NSAIDs inhibits formation of prostaglandins, which leads to delayed wound healing. And the immune deficiencies like diabetes and HIV patients, the immunity will be low and the wound healing will be delayed. Classification.
Vinod,
Yes.
how does this is a long question also for you. How does diabetes affect wound healing? As well as steroids, how does it affect wound healing?
Sir, as steroids inhibiting phospholipase A2, that leads to deficiency of prostaglandin synthesis and leukotriene synthesis, which the leukotriene B4 is a chemotactic factor which helps in transfer of neutrophils or macrophages towards the infection. And these prostaglandins help in development of, increase blood flow towards the infection, which leads to early activation of inflammation and healing, which is delayed in usage of steroids and diabetic conditions.
It also affects fibroblast proliferation and collagen synthesis.
Correct.
Yes.
Okay, and it also reduces the wound contraction.
Yes, sir.
So all these also affect wound healing. Okay, and how does diabetes affect non-chronic ulcers in diabetes? What are the causes for non-healing of those?
As the age due to diabetes, sir,
Yes.
it is a non-enzymatic reaction in which glucose, without any enzymatic reaction, it reacts with the cell wall and forms atheromas. A thick wall of the blood vessel, which leads to decreased blood flow towards the wound, which leads to ischemia and which leads to delayed wound healing, sir.
Anything else?
That is one aspect.
And
Hyperglycemia itself.
Glucose itself increases. It's a good diet for the bacteria, which increases the overgrowth of bacteria over the injury site.
Correct. Infection. Then what else?
And no, sir.
Abdul?
One is infection. It also affects the angiogenesis. It also causes neuropathy. So the
Yes, sir.
repeated traumas will happen without the patient knowing about it. Then it also causes formation of those hyperglycemic glycation end products, they say. And because of hyperglycemia. And
Yes.
As well as it causes hypoxia in the wound.
Yes.
Correct. See, other thing is you said malnutrition.
Yes, sir.
You are giving example of vitamin C, it's okay. But what is more important in malnutrition, man?
Protein deficiency.
Why are you talking about vitamin deficiency? Protein deficiency is the most important reason why you will have delayed wound healing.
Okay.
And of course, vitamin C, is a good example, but vitamins are not that, not that important compared to proteins in terms
Yes.
of the wound healing.
Okay.
And also the trace elements. For example, you have zinc,
Zinc.
and selenium, molybdenum, all of these things are, and then manganese, all these things are essential in wound healing. So you have, whenever there is chronic malnutrition, there is obviously depletion of the proteins, there is depletion of all the trace elements, and depletion of the vitamins also. So I think all of this is a combined factors that affect the wound healing. Okay, so those don't jump in on some vitamins or anything like that. Okay.
Okay.
Right. So other things, your immune deficiency, you said diabetes, you said HIV. What are the other conditions which cause immune deficiency? Chronic liver disease, chronic renal failure. Chronic renal failure, does the wound heal well in CRF?
No, sir.
So that is another condition. And patients who are on, as you said, who are on long-standing medication for, steroids, for example, patients who have connective tissue disorders, that itself can cause delayed wound healing, all the connective tissue disorders.
Yes.
And systemic lupus erythematosus and all these things. And in addition, if they are on steroids, again, that will also add to the problem. Mixed connective tissue disease, rheumatoid arthritis, all of these, you have delayed wound healing.
Okay.
Okay, right. Carry on.
Yes, sir.
Anybody wants to add anything else?
Vinod,
This is an
for
interactive session.
yes.
All of you need to contribute.
Vinod, for collagen synthesis, as
Yes,
in
sir.
wound healing, what are the factors required? What are the things required? Or what are the elements required?
Zinc, copper,
Iron
zinc, copper, iron,
and vitamin, which vitamin?
vitamin C.
Okay, how does vitamin C help there?
It is a cofactor for copper ferric oxidizer, in which
No, for collagen to be synthesized, hydroxylation is required of lysine and proline, which is done by both iron and vitamin C.
Yes, sir.
So any deficiency in this will impair collagen synthesis.
Okay.
Okay.
So just to, I think, add to what Abdul said, now the understanding of wound healing is such that even for hernias, it is the collagen synthesis deficiency which is now thought about as the cause for hernia, rather than all these factors like chronic cough and constipation and urinary incontinence and all these things. They may contribute a little to that, or they may make it manifest. But ultimately, people who develop hernia, if they are not, for example, the patent processes vaginalis, the chronic hernias, the direct hernias, are due to impaired collagen synthesis. Abdul,
Yes, sir.
do you want to elaborate on that, or is
No,
that
sir.
sufficient?
That's because that's all. That's for that reason only the role of vitamin C is so important compared to other vitamins.
Correct. Okay.
And the
Kavya?
arginine as well.
One thing, sir, since as Abdul said, it's an essay question. You could have divided it, classified into like wound factors, patient factors, and
Okay.
the environment factors. It would
Have you divided that, Vinod? I thought you had.
No, sir.
I thought you had divided it. Okay. I think, I think Kavya is right. You should have divided it into patient factors and the factors from the, diseases and things. And
Okay,
then, okay, continue.
Yes, sir. Classification of the wounds based on thickness of the wound: superficial, partial thickness wound, and full thickness wound. And partial thickness wound further divided into superficial partial and deep partial. And this helps in to understand whether the scar is formed during an injury or not. In first degree and superficial.
No, go back to the previous picture. You had a previous picture, no?
Yes, sir.
See, here you describe where is superficial, where is deep, all these things.
Yes,
On
sir. I
this,
will
on
explain.
this, yeah, explain on this one. Which are the strata involved in the superficial? Stratum corneum, lucidum, granulosum.
Except
Fine.
stratum bacilli,
Ah.
stratum bacilli, all are involved in superficial injury, sir.
Ah.
In superficial partial, this
Ah.
stratum basal actually stratum basal is not in straight line. It is actually in converted into dermal papillae, sir. So in the superficial partial infection, the only part the papillae which are elevated are involved in the injury, and the partial amount of stratum basal is left. In deep partial, the complete stratum basal is eliminated and the injury is in dermis. And in full thickness wound, it involves also dermis and subcutaneous tissues also, sir.
Okay. Right. Okay.
As
Good.
in, yes, sir.
Yeah. Carry on.
As in first degree injury, as the stratum basal is left in the intact, so the wound healing will be without scare. And in superficial partial injury, these are dermal papillae which are involved, and these clefts are left, which helps in healing. So the scar formation is minimal or nothing. And in deep secondary, this superficial deep partial wounds, there is a complete removal of stratum basal, so the scar formation will be present. In third degree wounds, as subcutaneous fat layers are involved, there is a no stratum basal, the scar formation will be there. And classification into tidy and untidy wounds. In tidy wounds, the wounds which are with less amount of tissues are lost, and the injury will be clean and healthy tissues, and the wounds are incised wounds which are used surgically. And untidy wounds are wounds which are formed due to contamination or crushed wounds, and there is a tissue loss, and these helpful to use whether to add antibiotics or not prophylactically in a wound injuries. Classification of wounds surgically, they are clean, contaminated, and dirty wounds. And this helps in adding the prophylactic antibiotics in an injury, in a surgical injury. This clean surgery. These are surgeries of heart, brain, joint, transplant, and excision of swellings where there is no inflammation or abscess. And clean contaminated wounds are those in which bowels, respiratory tract, genital tracts, and urinary tracts are involved. And contaminated wounds are wounds where when there is an opening of bowel and spillage of contents, and with infections, inflammations. And dirty wounds are wounds where there is a pus, examples like empyema, gallbladder, and fecal peritonitis. And basing on this, whether to add antibiotics or not, we will decide. If it is a clean surgery, the infection rate is 1%, even with antibiotic or without antibiotic. So there is no need of antibiotic in the clean surgeries. And clean contaminated surgeries, without antibiotic, the chances of infections are about 5 to 10%. With antibiotic, it is only around 3%. And in contaminated surgeries, it increases up to 20% without the prophylaxis. And in dirty surgeries, it increases to 40%. So in contaminated and dirty surgeries, we prefer to add antibiotics prophylactically.
No, not prophylaxis.
Sir.
See, these are not prophylaxis. It will be treatment. So there should be ongoing administration of antibiotics in patients who have contaminated and dirty wounds. In clean surgery, there is enough evidence to suggest that there is no need for antibiotic. For example, breast surgery, heart, though I think in heart, majority of patients are diabetic, they may have renal impairment and hence they give antibiotics. And in brain surgery also, I think they give one prophylactic dose because majority of them are for a prolonged period of time. And so there is potential for wound contamination from external agents. So antibiotics are given. I think the problem is, even though there is evidence to suggest that for clean wounds, you don't need to give antibiotics. What happens is you apply the principle of if it was you or your relatives, would you not give antibiotics? So I think that most people are on the side of giving antibiotics. It's not scientific, but it is what is done. But in clean contaminated, definitely one dose, and depending on whether there is any spillage and things like that, you can give 2 more doses. But in patients with contaminated and dirty, you have to carry on. You have to get a culture and then continue the antibiotics and change the antibiotic as and when required, depending on the condition of the patient. If the patient deteriorates, you may have to escalate. If the patient remains stable and you have culture reports which indicate that lesser antibiotic is useful, then you can de-escalate. But you cannot say prophylaxis for contaminated and dirty wounds. Okay.
Okay.
You
Yes.
have to understand that. Okay. Anything to add? Hari?
No, sir. Correct, sir.
Pavan?
No, sir.
Nidra vachinda?
లేదు సార్
Ah,
తింటా
okay.
ఉన్నాను సార్
You are not talking. Indraja, are you awake?
Yes, sir.
Yes, sir.
Right. Abdul, carry on.
Vinod, so a patient of hernia comes, which we operate. One dose is enough of prophylaxis before you write, no? Super safe 1.5.
Yes, sir.
So how much should we give?
Prophylactically, it's a clean injury. Actually, no need of antibiotic, but we can do 1 dose.
One dose only.
Yes, sir.
That is ideal recommendation. That
Yes.
is just 30 minutes or 60 minutes before the surgery.
Less than 1 hour.
Okay. Now,
Yes.
if you do laparoscopic cholecystectomy, there is a
Yes, sir.
symptomatic cholelithiasis. Now, how much is the ideal prophylaxis? Again, a single dose. If you don't open up the gallbladder inside. If it
Yes,
is
sir.
acute calculus cholecystitis, at least 3 doses.
Yes, sir.
One is prophylactic and a day of dose. And if it is severe severe empyema and all, then it becomes therapeutic. It's not prophylaxis.
Yes, sir.
Okay, so these basic surgeries, you should know how much you should give antibiotic and what antibiotic you should give also you should know.
Okay.
If for bile infection, what do you give?
In bile, sir, streptococcal infections are most streptococcal pyogenesis and staph is the most common infection in cholangitis, sir.
No.
No.
What nonsense are you? What nonsense are you talking?
how it can be.
For skin infection, what are the common for skin infection, what are the common pathogens? And based on that, the antibiotic should be given.
Staph or
Staph and strep. Which are the most antibiotic sensitive to staph?
amoxicillin.
Amoxicillin, clavinate, first ideal. Then,
And cephalosporin.
okay. Then linezolid for
And-
skin infection. For
Yes.
biliary infection, what do you give? You can give Supasef, but if you severe infection is there, then you need an antibiotic which is secreted in the bile.
Bile.
Which is that antibiotic?
Ceftriaxone, Magnix foot.
Cephalosporin sulbate. So you step up like that based on the
Or
where
even
the-
ceftriaxone is also well secreted.
Yes, sir.
So ceftriaxone can also be given.
Okay, if you touch the urine, like urinary operations, okay, what are the most common pathogens there and what are the antibiotics you give?
E. coli is the most common, and we will give aminoglycosides.
Huh?
E. coli.
Aminoglycosides you give. So you will give amikacin for you all urinary infections.
Chloroquine.
Vinod.
Sir.
Chloroquine.
Correct.
Okay. And now bowel contents. So what are the pathogens involved?
Most commonly anaerobic organisms,
So for anaerobic, what antibiotics?
metrogyl.
Yes, metrogyl should be added to a third generation cephalosporin, preferably.
Okay.
You will also have in addition, as I think Abdul said, you will have E. coli, Proteus, and all these Pseudomonas and all these things in the gut. In addition, you will also have anaerobes. So you
Yes,
have to add metronidazole. So don't try not to use this trade names. Use generic name metronidazole. Don't say metrogyl. Okay.
Okay. Okay.
Again, examiners may get irritated by that.
Yes.
Okay. So basically, you should know. You should have thought process should be activated when you start antibiotics. What is the infection you're treating? Where is the infection likely? And give antibiotics accordingly. Don't start, I think, like physicians, they start, cefotaxime for everything without actually understanding what actually they treating. I have seen physicians there, they think that they are they're better in terms of treating infection, but they don't put any thought process into what infection are they treating. So you, as Abdul said, if it is skin, and subcutaneous tissue, if it is biliary tract, if it is urinary tract, if it is gut, if it is upper respiratory tract, if it is lower respiratory tract, there are specific antibiotics because there are specific pathogens which causes it. Of course, you can have very rare organism causing infection, that is different. Then you have to treat it after you get culture sensitivity report. But we are talking about initiating therapy for infection. You should know what are the common organisms and what are the common antibiotics which are which are responsive to these particular pathogens. Okay, right. Continue. Abdul,
Yes.
anything to add?
No, sir, nothing. Sir.
Okay.
And for infections, we use Southampton scoring and asepsis scoring, which helps in early detection of infections and modification of treatment.
Go to
And-
Southampton score. Just don't, you can't just this one.
Okay.
You have to describe this.
Yes, sir. There is 5 grades in which grade 0 is normal healing, and grade 1 is only erythema, and grade 2 is erythema and with associated inflammatory findings. Grade 3 is serous discharge, and grade 4 is pus discharge, and grade 5 is deep and severe wound infections are breakdown of the tissues.
Okay. It's called deep space infection, man. Okay.
Okay.
Okay, carry on. And what is the next one? Yeah.
Asepsis scoring.
Yeah.
In asepsis scoring system, including to the Southampton scoring, we add a prolonged hospital stays and isolation of bacteria and additional treatments, and we give 5 to 10 points basing on the antibiotic whether you used or not, and we did a debridement or not, and basing on that we give the points, and we grade them into gradings basing on the points.
I didn't understand this at all. Did anyone understand this? Abdul?
No, sir.
I didn't understand it at all.
Yes, sir.
Describe it, man.
Okay. Asepsis scoring, in which components are additional treatment, serous discharge, erythema, purulent exudates, separation of deep tissues, and isolation of bacteria, stay in hospital prolonged over 14 days. In additional treatment, in which only if you add antibiotics, we give points of around 10 points. If the drainage of pus under local anesthesia, we give 5 points. If debridement of wound is done, we give 10 points. And for serous discharge, we give 0 to 5 points. For erythema, we give 0 to 5 points. And for exudate, purulent exudate, we give 0 to 10 points. If the separation of deep tissue is there, we give points of around 0 to 10. And if bacteria is isolated from the pus, we give around 10 points. And if the stay is more than 14 days, we give additional 5 points. Basing on this, we categorize the infection. If 0 to 10, it is a satisfactory healing, and 11 to 20, there is a disturbance in the healing. And if it is 21 to 30, there is a minor wound infection. And if it is 30 to 40, there is a moderate wound infection. And if it is greater than 40, it is a severe wound infection. Basing on this, we change our antibiotics and our treatment.
Okay. Now you made some sense.
And phases of wound healing: bleeding and clot formation, inflammatory phase, proliferative phase, and remodeling phase. In bleeding and clot formation, when there is an injury, there is a release of thromboxane A2, ADP, and von Willebrand factor from the platelets and from the endothelium. These factors activate the platelets, which form platelet work, which is temporary, and it is a main factor in the in blood stasis in a minor blood vessels. And in the formation of platelet plug, there are 3 phases. That is platelet adhesion phase, and platelet activation phase, and platelet aggregation phase. And when the patient is using aspirin inhibits thromboxane A2, which is helpful in formation of platelet plug. So there is an increased chances of prolongation of bleeding from the wound side. And so we do during before the surgery, we do bleeding time and clotting time. And due to aspirin, there is a increase in bleeding time. And permanent plug is formed by activation of clotting factors, which is by extrinsic pathway and intrinsic pathway. And this is the clotting cascade, in which extrinsic pathway is started by factor 7 and intrinsic pathway is activated by factor 12. And when there is a patient using warfarin, it inhibits vitamin K epoxide, which inhibits factors which are dependent on vitamin K. Those are factor 5, 7, 9, 12. And these leads to increased prolonged clotting time, and which leads to increased loss of blood during the surgery. And inflammatory phase, it starts immediately after an injury. It will be for around 2 to 5 days. And in the initial 24 hours, there is a neutrophilic rise in the injury site. And after 2 to 3 days, for around next 2 to 3 days, there is an increase in macrophages in the injury site. Macrophages engulf the debris and neutrophils, and macrophages gets activate and release the substances vascular endothelial growth factor and fibrogen growth factor beta and platelet derived growth factor and tumor growth factor beta. And these factors help in development formation of angiogenesis and development of fibrocytes into fibroblasts, which helps in formation of collagen. And this helps in conversion of inflammatory phase into proliferative phase. Proliferative phase, which starts after the inflammatory phase, just immediately from 5 days to around 3 weeks, in which the granulation tissue is formed, which contains blood vessels and collagen, and reepitheliation of wound surface will happen. And in this, granulation tissue contains collagen type 3. And the remodeling phase, it is the phase where the collagen type 3 converts into collagen type 1, and the blood vessels disintegrate from the scar, and now it is called as a scar. And the remodeling phase continuously take place, but it never reaches a strength of a normal tissue. Its maximum reaches about 70 to 8% by 1 year. These are the wound healing phases, which is inflammatory, proliferative, and maturation phase. Normal healing in bone. It also contains normal 3 phases, but in the remodeling phase, it actually contains only the osteoid which does not divide it into cortex and medullary phase. In the remodeling phase, it changes into endosteum and peristeum, and the cortex is developed now. And normal healing in nerve. In the nerve, when there is an injury, there is the distal end of the nerve undergoes Wallerian degeneration, which means first the axon disintegrates, and then the axon sheath disintegrates, and then myelin sheath disintegrates. And from the proximal end, the new nerve fiber starts developing. Shall I continue, sir?
Yeah.
Types of wound healing.
How many slides are there?
So less only now. Only the hypertrophic scar and all you just talk about.
Yes.
Yeah.
Types of wound healing. Primary intention, secondary intention, and tertiary intention. In primary intention, there is no excessive loss of growth, loss of tissue. So, and it is sutured, and the healing will be with minimal scar. And in the secondary intention, there is excessive loss of tissue, and the healing contains more scar, formation of scar, and excessive formation of granulation tissue. And in the tertiary intention, there is an infection which leads due to which the wound is left and that the infection is treated, and then the suturing is done, which is called as tertiary intention. And the abnormal scars, these are hypertrophic scar and the keloid. In a hypertrophic scar arises from the wound site, and it contains mature blood vessels and mature fibroblasts, and it is only limited to the only scar tissue, and more commonly seen in the flexor areas. And the keloids are it contains immature blood vessels and immature fibroblasts, and it does not form, it forms more commonly from the scars, but also it forms from the normal tissue, and it is a genetic, it contains the genetic predisposition and contractures. When the scar present in the joints, this leads to fibrosis. When the injury leads to fibrosis, there is a decreased movement, and which leads to hyperextension or hyperflexion, and these are treated by grafts or flaps or jet plastics. These are contractures formed in the neck and the hand. And the dressings. Properties of an ideal dressing. It should
Vinod, I think dressings is a separate class.
Separate class actually, I think.
Okay.
So you can't, I think you've done enough now.
Okay, sir.
Right. I think Abdul,
Sir,
carry on. Yeah.
yes, sir. Vinod, one thing. First, ideally, when you describe about the class on wound healing, you first
Yes, sir.
tell the phases of wound healing, and then you
Okay,
should tell about the factors affecting, because factors will affect the different stages.
Okay, sir.
Okay, so the phases should not come at the end. And third,
Okay, sir.
you should make your slides such that next time when you revise for your exams, the
Yes, sir.
three pictures should be in your mind. So this is very haphazard the way you have done it. It should
Okay,
be
sir.
like concise so that you can reproduce this in the exam.
Okay.
So
Okay, sir.
salient features, point by point, it should be done.
Okay, sir.
Any other questions from any of the PGs? Hari?
What will be your take-home message?
Sir.
Hari.
Sir, can you hear me, sir?
That is a wrong thing to ask in a class. There can't be a take-home message in wound healing and things like that, where or inflammation. It's a big topic.
Yes, sir.
There are multiple take-home messages. So you can't ask. If it is a paper, you can ask that.
Okay, sir.
Okay. But yeah, if you want to ask any other question.
No, sir. No other questions, sir. He presented. It's a vast topic. He presented well, sir.
Janani?
Pawan?
Sir, nothing. He presented well, sir.
Okay. Who else is there? Kavya, what do you think?
Sir, it was a vast topic. He presented well, but it was, as Abdul said, it was a bit haphazard. The order and this, he could have this classification, and it should have been a bit more better. That's all. Otherwise, good presentation.
Okay, Abdul, your final comments?
Sir, he has presented, the flow was not there. He has not rehearsed it, I think.
One point I wanted to make, sir. Here. Actually, from the last time he presented very well. So he showed the presentations also. Only thing I also asked him to put the faces in the beginning because as the topic says wound healing, the faces should be in the beginning. So, but otherwise the preparation was much better, like how we did in the beginning. So I asked him to prepare in front of a mirror. Okay? So preparation should be more in the beginning. But the way he answered is very nice. Sir. Preparation is good. The flow of presentation he should improve. Otherwise, he's very good. Sir.
And what is the source of this slides?
Sir,
Vinod?
I had collected from Bailey and Love, and 3 articles are there, sir.
So whenever you are quoting an article, the place where you are quoting that slide, you should mention it below.
Okay, sir.
Okay. So
Yes.
when you're quoting from this article, that slide, whichever slide you're quoting, you should put it in the below.
Okay, sir.
And pictorial, you should have increased. More pictures would have been better.
Okay.
There's a self-explanatory diagram, I think in Bailey only, where the phases of wound healing and factors affecting are mentioned.
Yes, sir.
Okay, if you had just put that and explain that one picture, no, in exam also, if you had drawn that picture and explained, so that adds to the values.
Okay, sir.
Otherwise, it was a good class.
Okay, so I think to sum up all that they said, one is, for a second class, it was a good presentation. So to take heart, but there should be more organization in your preparation and also in presentation. I think
Yes.
everyone has mentioned it is haphazard. I think it becomes a bit difficult because it is a vast topic, but you need to learn to organize. Again, I think you have not sought help. See, it doesn't drop from heaven. These things, unless you ask, nobody will volunteer to help you, because I
Yes.
think the onus is on you to go to anybody. Everybody are willing to help, but
Yes,
you
sir.
have to go and ask them. So you need to ask, show your presentation, tell them where you need to improve and all these things. See, I think Srikanth keeps on telling this to you guys and nobody follows this. You should not come to the consultant before you've gone to the other, your senior colleagues and your registrar.
Okay,
Most of the correction will happen with them. We are only there to final okay to the topic and some
Okay.
suggestions. So you need to involve your seniors. See, when you are sitting, it doesn't have to be informal. It can be informal also. But I think that is what you need to do. Get help from your seniors. As you
Yes,
become more seasoned, your need for help will decrease. But initially
Okay.
you will. So you need to use the thing and learn to
Okay.
organize your answers. That is why you should see the previous subject seminars and presentations, see how well they have organized it. If you, I think there is a huge library of all our presentations. If you ask Srikanth, he will show it to you. I think
Okay.
wound healing would have been done. So you could have looked at that presentation and change your slides accordingly. Okay, so from
Okay.
now on, you should do that.
Yes, sir.
Otherwise, your understanding of that subject is pretty decent because you answered
Yes.
the questions well. So I think
Thank
that
you.
is a positive again. So I think all of us know there is nobody who's perfect. You need to keep improving, keep changing, and
Yes.
keep getting better. Okay, good luck. Well done.
Thank you.